Today is Maternal Health Awareness Day, and this day actually comes as the U.S. leads the world with high maternal mortality rates. I'm sure you all are well aware with that information, but I did want to make sure that we got an expert to join me here at the live desk to really explain the significance of the day. Right now, you're taking a look at certified nurse midwife, Dr. Asia Greer from University Health. Dr. Greer, thank you so much for joining me here at the live desk. Let's jump straight into the conversation. What do providers like yourself, what do you all hope comes from a day like this?
We hope that we can get the word out there about maternal health, that Black women are dying at 3 times the rate of white women during and around childbirth. That is an astronomical number that we can certainly try to work on. So if we can get that word out, that people know that, maybe we can start to decrease that number. So we've got some things going on at University Health that would help to kind of get that number start dwindling down. And we also would like for people to start moving towards doing things working on themselves to help decrease that number as well.
I really want to draw our attention back to that statistic that you just touched on, the fact that women of color are 3 times more likely to die during or a year after childbirth. That is significant. Now, you mentioned the fact that you guys have a program at University Health called Elevate. Speak a little bit more about that and what you all do for women.
Elevate is a program that originated out of WashU University. It's a brainchild of Dr. Ebony Carter, and Dr. Tracy Johnson is our project investigator here in Kansas City. We have a satellite location at University Health Women's Care in Lee Summit. It's group prenatal care with a huge mental health component. So we do a lot of mindfulness. Our entire staff has been trauma-informed care trained. We do the prenatal visits in lieu of what we would do for standard prenatal care. So you would come to class in lieu of going to your standard prenatal visit. So during those courses, there's a lot of information about what you would learn about your pregnancy, communication, information about mental health and how to maintain good mental health during your pregnancy, information on how to advocate for yourself during and after pregnancy, all kinds of information about how to cope with the changes of your body and information on how to become a parent and how to plan for future pregnancies. So there's tons of information in the class, and that helps to give education to women and also to have a sense of community of other women around them. That helps to decrease the stress in the pregnancy. Also, having the staff trauma-informed trained helps to decrease that stress, which helps to decrease that increased cortisol, which is causing these poor outcomes with women of color.
And you know, mental health within itself, I think, it can be overlooked a lot of times, but especially maternal health. So that's why this day is so important. But who can enroll in this Elevate program that you all have at University Health?
So it's still in the stages of being a study, and it's a randomized selection. There are some qualifications that people need in order to be enrolled, and they're very, very, very broad. So you would have to be either single, unintended pregnancy, teen, uh, history of any abuse or trauma, any history of depression or anxiety. So lots of different reasons people are included. There's not a lot of exclusion criteria. It, being outside of African American does not exclude you from the program. You can be in the program no matter what race you are. So it will benefit any moms during this class. So the randomization is 2 to 1. So we can't necessarily pick people to put in the class unless they've been randomized into it. So when they call for their first visit, they can just mention that they're interested, and then we can see if they qualify, and we'll send their information so that they can be randomized.
And before we hopped onto the live stream, you kind of spoke about your experience and the fact that you have been doing this for years. But from your own perspective, how have you seen pregnant women and people who just gave birth, women who just gave birth, how have you seen that they have been impacted negatively? Just speaking on your own experience.
Well, it's really easy to see because when we have women that are in the program that truly qualified for it because of their situations and they're not able to truly complete the program, um, those outcomes are truly seen. We see the low birth weight, we see the preterm birth. So it's not difficult to see um, what lack of having this program brings. So with having it, we've had some really good outcomes, and I hope that that continues, and then we can continue to try to decrease having these really tiny early babies that also contribute to the infant mortality that we have in this country as well.
Like I said, and like you've mentioned, the fact that this can impact anyone, but it is definitely something that, just like I said, kind of goes, we overlook it most times. And I wanted to make sure that we brought this into the spotlight today, especially on Maternal Health Awareness Day. Where can people learn more information, not only about the program, but maybe statistics and how they can get involved?
Well, you can look on our website to find out more about how to get involved at University Health. Also, a lot of this is personal growth, recognizing your own biases and learning how you can make a difference in how people are treated, and recognizing that there's a lot of people have trauma. We don't know where people are coming from and where they're going next. So treat people with kindness and compassion and love, no matter who they are. And if we can treat people equally and hear people out, that's really the key. Is just treating people always the same.
Treating people with kindness, compassion, and love. I think you ended that perfectly, Dr. Greer. I want to thank you so much for joining me here at the live desk to talk about this important and very timely topic. So thank you so much for taking the time.
You're welcome. Thank you for having me.
Of course.